like to welcome back Martha Clopin. She is a graduate from the graduate of New York University and has been a licensed general attorney and registered planner since 1995. She hosts a weekly radio show called A Medicare Moment with Martha and co-produces a weekly program on community television by the same name. Martha also conducts quarterly Medicare pre-retirement workshops for several companies and nonprofit groups throughout the island. She is also a founder of the annual Miss Medicare Age of Elegance pageant launched in 2014. Prior to transitioning to the healthcare industry, Martha worked as an assistant vice president for Bishop Trust Company and as a trust officer with the First Hawaiian Bank. She was a former vice president with Morgan Stanley, Dean Witter Reynolds in Manhattan. And now Martha is currently on the board of the Hawaii Pacific Gerontology Society, the American Businesswomen's Association, and the Family Education Training Center. And with that being said, here is Martha Clopin on Medicare enrollment periods to help you avoid penalties. Take it away, Martha.
Okay, can everybody hear me okay? Okay, well, just a correction. Desmond, you said attorney, but I know you didn't mean attorney. And I saw someone with his hand up and he was probably saying, did you say she was a general attorney? So no, I'm not a general attorney. I think it was just talking about insurance advising or something like that. So I'm very delighted to be back today. I want to thank everyone on the board of your organization for once again inviting me back. This is one of my favorite groups to talk to because I do actually get people who call me, and not only have they called me, but the information that I've helped provide them with has been very, very helpful and saved them a lot of money. So I was asked today to talk about the Medicare updates for 2023 and wanted to include some new enrollment periods that will help people avoid penalties, because one of the unknown things about the transition to Medicare is if you don't do it properly, you can end up paying penalties that truly can wipe out your savings. So I've been doing this for over a dozen years, so I know it's true, and I'm happy I can help folks. So I think, Desmond, you're going to be turning my slides for me today because we're ready for the next slide. Okay, the next slide is just a disclaimer. Of course, anything that I say today is for educational purposes only. Everybody's situation is different. No one size fits all when it comes to Medicare. So I encourage you, if you have any questions, you're welcome to contact me after, and I'll direct you to the proper entity so you can make decisions. But what we're talking about today is just for educational, informational purposes only. Next slide. Now, the reason I included this slide is because I've gotten, I would say, hundreds of calls. I'm not exaggerating, hundreds of calls from people asking me if these Joe Namath ads are legit, if they should be calling these phone numbers, and sometimes they do. So the only reason I'm including this one today and the next slide as well, it says if you're on Medicare, this is important information. And the next slide also, Joe Namath's, they have a testimonial from someone. I called the Medicare coverage helpline and they instantly advised me that I wasn't getting all the benefits I deserve, yada, yada, yada. You got to really be careful if you're calling this number, because this is not Medicare. This is really for sales. So I will not be covering sales today, how to choose one Medicare Advantage plan versus another, or how to choose one Medicare supplement plan over another. I understand that you bring somebody in to do that. So I don't need to be duplicative. And what I do with you folks today, and when you call, I do it as a community service. I'm not doing this as an agent to get a lead, to get paid. This information has saved people tens of thousands of dollars. And I'm very, very happy that I can be a person that provides this information at no charge but I know it helps people. And why is that? Because the insurance companies do not pay folks to give information. They pay them for sales. So I found out there was really a void. People need this information, and I'm happy to be the one to share it. Next slide. So first, what is Medicare? I still have to do that. Medicare is a federal health insurance program. It's run by the Centers for Medicare and Medicaid Services, and benefit decisions are controlled by the US Congress. So when you get really unhappy, when you find out Medicare doesn't cover something, I just had a person just this morning, she texted me and she wanted to know, does Medicare cover a tummy tuck? I was like, no, no, it doesn't. But if your doctor says there's some other issues and tummy tuck may be able to be done because of those other issues, well, that's between you, your doctor, and the insurance company. But a tummy tuck for cosmetic purposes is not covered by Medicare. And who made that decision? Congress. So don't get mad at the insurance company or the insurance agent. Talk to your congressperson about that. And the other thing that people don't understand when it comes to Medicare, Social Security Administration handles enrollment and eligibility. So I cannot tell you, even from your group, how many phone calls I received in the past few years that I've been doing this. And they said, Martha, I called Medicare to get my Medicare, and they told me I had to call Social Security. And they're totally just, stunned that Social Security handles that part of the process. Once you have your Medicare Part A and B, you have questions about Medicare, then you can start calling the Medicare number. Because remember, there is no physical Medicare office for the 63 million Medicare beneficiaries we have, and that number is growing every day. 63 million people, when they need to talk to Medicare, they need to call a 1-800 number. So I love what I do because I help people frame the questions before they have to be one of 63 million people who might be calling on any given day. May I have the next slide, please? Now, if you do not qualify to delay your Medicare, you have 7 months to enroll into what we call traditional Medicare Part A and traditional Medicare Part B, also known as original Medicare. So a lot of people get this confused, with applying for your Social Security cash benefits. This is totally separate agency, even though you go through Social Security, but these are the rules for enrolling into Medicare insurance, totally separate from your monthly cash benefits. I get a lot of folks from your group who told me they didn't know they had to sign up for Part B at 65, A and B, but they told me it's because they were waiting till age 70 to collect their monthly cash benefits. So they were unaware that the cash benefits and the Medicare are separate, and you can't put them together. You have one set of rules for picking up that monthly cash benefit, a different set of rules for the insurance, and whether you need to enroll or not depends on a lot of different factors, which I will cover. But this is the time frame when you can enroll in traditional or original Medicare A and B, if you need to. It's 3 months before your 65th birthday. It's the month of your 65th birthday, or up to 3 months after your 65th birthday. Why is this important? Because if you do it outside of this enrollment period, there can be penalties. And I've met many, many people who are in that penalty phase. And I've met many, many people that I have saved from the penalty phase. So that's why I always like to share this when I do a presentation. Next slide. Now, there are 4 parts of Medicare. Medicare Part A takes care of hospital insurance. If you have worked enough credits, it's 40 credits or about 10 years, you will pay no premium for those Part A hospital insurance benefits. So you get Part A at no cost. 99% of beneficiaries do not pay for Part A. That leaves 1%, and they do have to pay because they did not work long enough to qualify for Part A free Medicare. Now, there's a deductible with Medicare Part A, but you don't need to concern yourself with that. The focus is just understanding how these parts of Medicare work together. Then there's also Medicare Part B, as in Bravo, that takes care of doctor visits, lab work, things like that. The monthly premium actually decreased in 2023. It's $164.90 this year, and that's the standard rate. We'll talk next about how higher income folks pay more, but the standard premium is $164.90. Now, it doesn't matter. Everybody pays this Part B unless somebody pays it on their behalf. Sometimes you might have worked for a company that provides this when you retire. They'll cover that Part B premium. If you are on Medicaid, those are for folks who are at the federal poverty level. The state of Hawaii may pay your Part B premium, but no matter what Medicare plan you sign up for, and this is another area where people get confused, no matter what plan you sign up for, someone's going to be paying that Part B premium. So Part B, no matter how many work credits you have, Part B, no matter what Medicare Advantage or supplement plan you sign up for, someone is responsible for paying that Part B premium. That will continue as long as you meet your Medicare. So $164.90 is the new rate for 2023 for people who are not subject to the higher rate. Part C and Part D will be left to the Joe Namath commercials and the brokers out there because, again, that's the other thing that's very confusing to people when I start talking about enrollment periods and all these different things that you need to do. What happens, unfortunately, people, they get it confused between original Medicare, Medicare Advantage plans, Part D plans, and all of these things are totally separate and different. So next slide. Oh, I'm sorry, I'm too close. I can't see myself because I had to change my device. So maybe I can go off camera. I don't know how to even do that. Okay, can everybody, hopefully, can somebody let me know if you can still see me, hear me? Okay, so what we will be talking about is original Medicare, again, Part A and Part B. And I'm sorry we're having technical difficulties, but believe me, this is going to be very, very, lost audio. Can you hear me now? If somebody can let me know if you can hear me now. Oh, great. Okay. Thanks, Robert. Thanks, Lisa. Greg. Okay. I don't know what happened to the video, but anyway, I'm looking at the sample of the original Medicare card, and that's what we'll be talking about today, the benefits that go along with this and how to avoid those penalties. So what I'm talking about today, again, is this red, white, and blue original Medicare. This is original Medicare. We're not talking about the Part C. We're not talking about the Part D. Those are totally separate, but this is the important information that for anyone who will soon be Medicare age and may need to make a decision, or someone who's already there, the information I'm going to cover next, I believe will be helpful to you. So next slide. Okay. Time to go over the year-over-year Medicare cost comparisons. A lot of folks call me and they want to know, my Medicare went up, how come I'm paying so much more? So just like anything else, Medicare costs do go up. So the Part A premium, for those who pay a premium, and remember, not everyone does. Remember, 99% of folks do not, but that 1%, they pay it. And what it is in 2023 is $506. I actually had a gentleman who came over from another country, and he made his residency requirement, and he's ready to pick up his Medicare Part A, and it will be costing him $506. So this is a very, very valuable benefit. Don't think, oh, it's government insurance, I don't like it. This is a very, very, very valuable benefit. And for those who earn the credits, you save $506 a month by not needing to pay for it. The deductible this year, it has risen from $1,556 to $1,600. That's for people who just use their Part A alone with no other coverage. If you needed a hospitalization, you would pay the first $1,600 of the cost of that hospitalization. This is another area where people get confused. If you are getting your Medicare through an Advantage plan, a supplement plan, or you have Medicare and employer coverage working together, then that deductible may not apply to you. So again, when you're talking about original Medicare, it's different from those other Medicare options out there. Now, if you had, again, Part A only, and you were in the hospital, if you were in the hospital for the first 0 to 60 days, you pay that $1,600 in 2023. But if you needed to be in the hospital between days 61 to 90, you would be paying $400 per day for that hospital stay. If you were in the hospital days 91 to 150 days, and I got to tell you, 3 years ago, I didn't know anyone who stayed in the hospital for more than a week, I will say. And I have someone that actually is a client of mine, and he's been in the hospital for almost 2 years. So fortunately, he has the type of coverage. He doesn't have to pay $800 a day for days 91 through 150 on top of being very, very ill. Can you imagine $800 per day? But this is what that cost is. And that's why people pick up those other options to get their Medicare, because straight Medicare can be very expensive. There's another benefit that is increasing in 2023, and that would be the Part A skilled nursing copay. Again, if you are using just your Part A all by itself, it was $194.50 in 2022, and that's moving up to $200 in the year 2023. So if you needed a skilled nursing stay and you just had your Part A, no other coverage, you would pay $200 per day. Now, the Part A skilled nursing benefit covers 100 days in what's called a benefit period. So if you needed to be in a skilled nursing facility for more than 100 days, then even that $200 copay would go away, and you would be responsible for 100% of the cost, 100%. Part B premiums, again, I mentioned to you, look at that, something actually decreased. So the Part B premium went down from $170.10, the standard amount, to $164.90. Part B deductible also decreased. It was $233 in 2022. It is $226 in 2023. And then the Part B coinsurance, that's what, again, people with original Medicare Part A and Part B, if they just have that and they don't pick up one of those other options, they would pay 20% for services that come under Part B, as in Bravo. That has not changed from 2022. As a matter of fact, hasn't changed in decades. So you're responsible for 20% in 2023. That is your Part B coinsurance. Next slide, please. Now we're going to get into the what the cost is for those who are higher income beneficiaries. Now, I get a lot of calls about this, especially from your group, because you tend to be higher income folks. And a lot of times when you transition to Medicare or you're thinking about it, you look at these costs and it's like hard to believe that this is what you have to pay. But these are the rules. This started in 2007. You can go to ssa.gov if you want to check these. You can call Social Security. You can call Medicare if you want to check these numbers. But if you were a single person and you earn less than 97,000, I have to squint because I'm on a small screen, and you pay less than 97,000, you pay that $164.90. But if you pay between 97,000 to 123, you can see that your 2023 Part B would be $220.80, I think it says. And then it shows you next to that what that annual cost will be. Now, you might be wondering, 2023 Part D drugs, what? So there's also a extra amount that you have to pay if you pick up a Part D drug plan. And that's showing for someone in that 97 to 123, it's showing, I think it's really small screen, $45. And then again, it shows you the annual cost and your total cost for those Part B adjustment and Part D adjustment. So remember, $164.90, but then if you pay, you make more, you have to pay more. Now look at that $500,000 and up. That's the last line. And I have folks, that pay this. And I remember I was doing a presentation for retirees of Queens Hospital. They have me come in every 3 months and talk to folks who will be transitioning to Medicare. And I talk about the standard amount. And then I had this guy, and he goes, Martha, I was at your session last time, and and my premium is $500. What's going on? And I said, well, sir, how much is your income? So his income, he and his wife together, it was well over $500,000. So I said, well, you pay more because your income is more. So he said, that's unfair. I said, well, you give me your $1 million salary and I'll pay your Part B premium for you. So he was like, no, I'll just keep my salary. But yes, if you make more, you pay more. And of course, this was a single filer. I'm going to do married filing jointly next. But the important thing I want people to be aware of, if your group, and again, these are the folks that end up with the penalties, the gaps insurance, paying money they never ever expected to pay. There's penalties if you do not sign up for Medicare when you were supposed to. And the fact that you didn't know is no excuse for Social Security and Medicare. So imagine if you were in this higher income category and you ended up needing to pay these IRMA costs, then your penalty is factored on that. So very important to really understand how Medicare works for you, not the salespeople selling you all the plans, but what do you need to do about this first part of Medicare, navigating original Medicare. So on the next slide, I give the same numbers for married filing jointly. So I'm going to try to look closer, see if I can get that. And what I want to point out again about this income related modified adjustment amount, IRMA is what we call it in the business, but higher income beneficiaries pay more is all you need to think about. But the interesting thing about this is I have talked to people who said, well, Martha, I'm retiring, so I won't have the income I had a year ago, so I won't need to worry about this. I'm going to pay the standard amount. But what they don't know is what Social Security does is they look at your income from 2 years ago. So people who are qualifying for Medicare insurance this year, 2023, or required to pick up their Medicare in 2023, in order to determine whether you will be paying more for your Medicare Part B and your Medicare Part D if you pick up a drug plan, you look at your income tax return for 2021 for 2023. You heard me right. You go back 2 years because that's what they look at. They look at your modified adjusted gross income in 2021 for 2023. So again, someone in that highest category, married couple, 750,000 and up. There it shows the 2023 Part B premium that they would pay. And you have to remember, this is not one person pays. This is for each person on Medicare. So let me point that out too. It's not $540 for two. It's $540, or I can't read it too well. Whatever that number is there at the bottom, hopefully you can read it. It's per person. Medicare is always by per person. So that's why I think it's so important to really have a conversation with someone who's willing to talk with you for a little bit more than about what plan to choose. You really need to understand what you will be paying once you have your Medicare coverage. So this is for people, if you need to sign up for your Medicare Part A and Part B, you will pay more if your income is more 2 years ago. Now, I have helped people get that amount down. If it turns out that, let's just say you got some kind of special payout in 2021 and now 2023, you will never have income like what you had in 2021. There's a form, and I love forms. It's called the SSA 44 form. And what you do is you make a request to Social Security to redetermine your modified adjusted income and bring your premium back down to the standard amount instead of the higher amounts that you see listed here. Next slide. I'm trying to tap the slide. I forgot. I'm not controlling this. Next slide, please. Okay, so I know that was a mouthful, and now I'm going to move over to key changes under final rules from the White House on Medicare enrollment and eligibility. Now, every year people want to know, hey, is Medicare going to be around? Is Social Security going to be around? Hey, I don't make those decisions, but remember what I said, there's 63 million people that have Medicare, and that number is growing by about 10,000 people every single day. So do I think that the administrators, Congress will decide to get rid of Medicare? I do not. But will you possibly need to pay more in the future? Is it a possibility that they will increase the age in which you qualify for Medicare insurance? Maybe those things are possible. But right now, I can only speak to what is in place now. So for now, there are 4 key changes that occurred and are in place. And that is what I'm going to talk about for folks who may already be on Medicare and just want to know what is new. Next slide, I'm just going to take each one separately. It's a lot on that one slide. So changes to the initial enrollment period. Changes to the initial enrollment period. What is that? Well, if you remember from a previous slide, I talked about the time period that you have to enroll in Medicare, and it surrounds your 65th birthday. I don't have to go over it again, but if you signed up in the last 3 months of your initial enrollment period, you used to have to wait for a whole year before you could possibly get enrolled again. So they've made some changes to that. And if you have an opportunity you find out that you needed to sign up for your Medicare and it's the 3rd month after your birthday, used to make you wait 3 months. Well, there's changes to that. And now your enrollment in Medicare will start the first day of the month after you sign up for the plan. So no longer do you have this 3-month gap waiting for your Medicare insurance to start. And if you've lost employer coverage and have no other coverage, you could have a gap. That's what I'm talking about. You could have a gap because I've talked to those people. So they have finally made a change to that. And if you are in the 3rd month after your 65th birthday and you enroll, you will be enrolled in Medicare the next month. Used to be you had to wait 3 months. Okay, so that's done. Next slide. Another change is there are 5 new special enrollment periods. There are enrollment periods for individuals impacted by an emergency or disaster. I had a couple people referred to me by Queens Hospital, and they never signed up for their Medicare Part B. They were working. They lost their job during COVID. They were just so stressed out. They didn't know how to complete the process, and they ended up in the hospital, unfortunately, with a diagnosis that required them to have chemotherapy, which would be covered under Part B as in Bravo. They never picked it up. So I was able to find a way for them to enroll because the Social Security offices were closed for 2 years. And these folks, they were living in a remote area on the Big Island. So I was able to get Social Security to honor their enrollment outside of the period. So now they've created a special enrollment period if you have been impacted by a disaster. So I guess they're expecting more. Also, individuals who experience a health plan or employer era. I cannot tell you how many people from your group, when I did this presentation before, and I mentioned that if you are a solo practitioner, you're over the age of 65, even though you have employer coverage, you still may be required to sign up for Medicare. Now, if you go through a company like ProService or Altrez, then, you might be considered multi-employer and you don't need to do that. But anybody else, you would need to sign up for Medicare B. Well, I had some folks from your group get pretty stern with me that was not true, because they talked to they talked to the insurance company, and the insurance company said, you have employer coverage, you don't have to sign up for Medicare. Well, they never told the insurance company that they're over 65, and they, it's just their one, person practice. So what Medicare understands now is that sometimes people are getting bad information. This leads to an error, and this could cause some serious problems with not having coverage, and also penalties for not applying when you were supposed to. So within 60 days of within 6 months of finding out that somebody guided you incorrectly, they're willing to let you go ahead and pick up your Medicare Part A and Part B if you need to. Number 3, people who were formerly incarcerated. I actually worked with a gentleman some years ago who contacted me. People just call me, I don't know who they are. And he said, Martha, I just tried to get my Part B and my penalty is $10,000. I was like, no way, it can't be. Let me work with you on this. So what I learned is this gentleman had been incarcerated for 5 years, did not pay his Medicare Part B premium. So what Medicare was saying is that you are required to pay back 5 years of premiums in order for us to reinstate your Part B. And this gentleman, I don't know what he was in for, but he didn't have the money. So I was able to write one of my letters for equitable relief. Basically, I said, he was wrong. He didn't know. He's going to Queens Hospital every 2 days for his insulin. It's costing taxpayers. Can we just waive the $10,000? And it took 4 months, but they did waive it. The gentleman called me to let me know he got his Part B. They waived the $10,000, and we were both like crying on the phone. I was like really happy I can help him. And I said, sir, by the way, how did you get my number? And he said, oh, at Halava Correctional Facility, we listened to a Medicare Moment with Martha every Sunday. I thought that was really weird, but maybe that's how people decide not to do crimes, because they don't want to listen to Medicare programs every Sunday morning. Also, individuals who lose Medicaid coverage also have a special enrollment period if they miss out. And then 5, they left it kind of open, freestyle, other exceptional conditions. For example, let's say you were working and you had employer coverage, so you did not need Medicare because you were working for a large company, but you were hospitalized, you missed your period, there was no one to help you, they may consider that as well. So this is brand new for 2023. They've opened up 5 new special enrollment periods. So if there's anyone listening who you learn through this session or otherwise that you missed your enrollment period and you're required to sign up for Original Medicare, please reach out to me. And it's so much easier now. I don't have to write all these, come up with ways to explain why we are asking for an exception. Now they've created these exceptions that allow you to get your Part A and B outside of your normal election period. Next slide. Changes to the general enrollment period. If you miss your general enrollment, if you miss your initial election period surrounding your birthday, there's another enrollment period. It's called general enrollment period, goes from January 1 to March 31st. That's still intact if you missed it. And it used to be, if you signed up under this general enrollment period, you would not get your coverage till July 1st. They've changed that. If you do your enrollment under the GEP, say March 31st, you will have coverage April 1st. If you miss this general enrollment period and you don't have a special enrollment exception, you have to wait till next January to apply for your Medicare Part A and B. Next slide. I'm running out of time, so I won't talk too much about this, but this is a new Part B drug benefit. And believe it or not, someone who had a kidney transplant, maybe they were able to get Medicare for a period of time, and then they might lose their Medicare. Maybe they were under the age of 65. They had it because they had end-stage renal disease. Somebody found a kidney, got it to them. But once that Medicare coverage ends for them, they had no way to cover the cost of the drugs that help them, that stop that organ from rejecting. So they have a new rule now that you can't kick people off, so that they got this kidney transplant. Now they don't have access to the anti-rejection medication. So that's been changed. So it only applies to a small minority, but if it's you or someone you love, that was really frightening. You went through a transplant and now you lose your Medicare access and you can't get pay for the drugs so that it doesn't reject. So they fixed it. Next slide. Okay, so again, from your group, a lot of folks may have been working for a law firm. Your coverage ends and you're older than 65. So if you were covered under your employer plan, you are still required to have that Medicare Part A and B before that employer plan ends. A lot of folks think they can pick up COBRA and COBRA will cover them. And when I have to tell them COBRA will cover people under 65, but if you're 65 or older, you got to make sure you have your Medicare Part A and B before that employer plan ends. And I've had folks fight with me about that. So instead of making my little fancy slides, I have a couple slides that just show you that that can happen. So next slide. Next slide. Okay. Also, before I get to that, I just have here, you and your employer must work together to get your Medicare Part A or Medicare Parts A and B. A lot of people don't realize that if you're not collecting Social Security cash benefits, you've been on an employer plan, you turn 65, the card is not going to magically appear. You will need to initiate that process. Also for a spouse that may have been covered under your plan. Sometimes spouses are older and they may need to get this Part A and B for everything for you to be in compliance. But you definitely need your employer once you're over the age of 65, because your employer will have to fill out forms that verify you had continuous health coverage from the age of 65 and beyond. Why? Because there are penalties that come into play if you pick up your Medicare Part A or Medicare Part B or A and B after age 65 and you did not have employer coverage. I work with folks who have bills in the hundreds of thousands because they thought they had time or they thought they could take COBRA until they figured it out. COBRA pays after Medicare. So if you do not get your Medicare, COBRA won't cover. So guess what? You'll be responsible for 100% of the bill. Next slide. Now here, I did not make a very pretty slide because I know, you folks want the real deal from Medicare.gov directly. So really small print, but in the question, does COBRA end when Medicare begins? But that's not the part that I want everybody to see. I want people to see that it's very important you get your Medicare Part B immediately, and immediately in the Social Security world is please do it at least 2 months early, but you need to, because if you are not entitled to a special enrollment period, COBRA again, does not pay first. You will need your Medicare after age 65. So this is an attempt from Medicare.gov to explain to you that you need to understand just taking COBRA, if you're over 65 and your employer plan ends, if you have a big bill, and I've been there with folks, all of a sudden somebody will say, oh, wait a minute, COBRA pays second. The insurance company that's administering the COBRA says, oh, we're in second position. Where's your Medicare? If you didn't pick up your Medicare because you didn't know you had to, because you didn't understand, because you just had other things going on in your life, you could end up being responsible for 100% of the cost that, Medicare would have covered if you had it. Next slide. This slide says the same thing. Again, I just want people to know, can I have COBRA and Medicare at the same time? Absolutely, you can. But COBRA may only pay a small portion of your medical costs. Please read that. Again, no fanciness. This is direct from Medicare.gov. You can call them and check. COBRA may only pay a small portion of your Medicare costs, and you may have to pay most of the cost yourself. So please read that, please. Why? Because again, I have had to tell folks this and they weren't very happy, and I don't want to get shot. I don't want to be the messenger that gets shot. So rather than fancy up the slide, people think, oh, I misheard her. She doesn't know what she's talking about. Who does this apply to? This applies to people who have, for example, a solo practice or less than 20 people. They do not have what's called multi-employer status, and they are responsible for getting their Medicare at the age of 65, even if they have employer coverage. If you've retired, you've taken COBRA, somebody said, oh, you can have COBRA. Yes, you can have COBRA, but Medicare will pay first. If you don't know that, that's how you get into trouble. And I want to thank the folks who did listen to me and did get taken care of, because I got to tell you, some people, they did not have any health problems at 65, 66, 67. They did not even realize there was anything amiss because the employer plan kept paying the bills, even though they were solo practitioners and they did not have this multi-employer status. But guess what? As they got older, all of a sudden, you need a hip replacement, a knee replacement, a huge bill shows up for $86,000. All of a sudden, somebody's looking to see, was Medicare supposed to be primary and was the COBRA or employer insurance supposed to be secondary? They decide, oh, yep, Medicare was supposed to pay first. You didn't get it. Guess who has to pay the $86,000? And I've been at the bedside of someone who had to pay $150,000, and I was able to fix them for the first of the following month. But their charges, even though they had an employer coverage, they were still responsible for the charges because they did not know Medicare was supposed to be primary. Next slide, please. Okay, enrollment period. If you miss your initial opportunity to enroll, it's January 1st through March 31st of each year. And if you miss that period, you have to wait a year. So that's how some people end up with the penalties, because they missed their initial enrollment period, which surrounds the birthday. And they also missed this general enrollment period, which is once a year between January 1st to March 31st. Again, why do people get confused? Because they hear Joe Namath talking about Medicare enrollment, October 15th through December 7th. That's not what we're talking about here. We're talking about original Medicare guidelines, rules, and deadlines. Next slide. Okay, here again, I circled it. This is for those folks. Again, I didn't pretty up this slide and it's a little small, but this is directly from, you can find this at the SSA.gov website, but it talks about if you have Medicare and you less than 20 people and you're not a multi-employer, just letting you know, you are required to get Medicare Part A and B. I'm not telling people anymore. I'm always just directing them directly to this material or telling them to please call Social Security or Medicare. But when you do, please tell them that you work for a company less than 20 and you understand, and you're not covered by, you're not a multi-employer, and you understand you may need to sign up for that Medicare Part B. So let them tell you or let their guidance direct you. Next slide. Okay, coordination of Medicare insurance and employer group plans. I just want to talk about this real briefly. I'm going to try to leave some time for questions. I put this up here, coordination of Medicare insurance and employer group plans, because some people find out that after the age of 65, they work for a company less than 20, they're not under a multi-employer, but they're afraid of Medicare. So they are required to pick up their Medicare Part A and B. They go ahead and do that. Medicare will pay first. The employer plan will pay second. And some people just want to stay that way because they're so frightened that if they go off the employer plan, everything's going to go, bump in the night. But the reality is that the employer plan is only paying 20% of the Part B cost and the deductibles we talked about earlier. So if you're a solo practitioner or you work for a small group, your insurance could easily be costing $2,000 to $2,500 a month. And you're required to have your Medicare Part A and B. So in other words, just recognize that maybe you want to take a look at what Medicare covers, what options can reduce your Medicare costs, because you keep the employer plan when you're required to have A and B, you're probably paying more than you have to for coverage. But everybody's situation is different. So I always like to do the numbers, and I don't mind because sometimes it's like, no, stay on that employer plan no matter what. These medications you're on would be very expensive under Medicare, and other people, I've been able to help them save over $1,000 per month by understanding how these things coordinate. And in some cases, you may want to go ahead and pick up your full Medicare option and let go of the employer plan. But everybody's case is different. Next slide. All right, if you want to hear me more, I do a radio show that is now syndicated throughout the United States. But here locally, you can hear me on 690 The Answer on Sundays at 9:30 a.m. or 94.3 FM. Next slide. Here I just wanted to give you a little testimonial. I was on Living 808 on Monday, and this gentleman said he was writing out his Cobra check for $1,600, and he heard me say Cobra, and it just grabbed his attention. And he said, he couldn't believe it when I was able to talk to him about some things, and he doesn't need the Cobra. So he basically just said, hey, I saved $1,000 because I got this great piece of advice, listening to Living 808. And he did send something to the station as well. And I know it's unusual for somebody to help you save thousands of dollars or get you in compliance for nothing. And people always say, what's in it for you? Somebody even said, I won't work with you unless you send me a bill. I was like, I'm sorry, sir, but can I just get you compliant first? And we worked that out later, and I still never billed him, but I love this group because I've been able to help so many. So I wanted to just include this so you know that this information is not readily available because nobody gets paid for showing you how to save money. And I value every single person on this call today. I value you. Somebody told me, you don't value yourself if you give so much away free. But I want to tell you that it's such a value to me to know I'm helping my community. And that's why I wanted to include this. Next slide. This is an app that I have. You can text on your smartphone, free app. You can text on your smartphone the word Medicare 36260. And this is a way to hear my radio shows and get other information. It's no charge for it. Put it on your phone and then you can reach out anytime. And one more slide. I think we got one more slide. This is an app I created. I'm really excited because I created this because I talked to so many of you who said, once you get these, Medicare cards, should I laminate it? What should I do? So I created an app on the App Store and Google Play for Android users. And it's $1.99. And it's just a way that you can store your insurance cards. So, and doctor names and medications and things like that, just a place to store it. Now I know some people don't like storing things on their phone, or they have another way to store it, and that's fine. But I just did this because I said, hey, you need to have a place to store this stuff. So here's an app to do it. Next slide. I want to thank you so much for your patience with the technical difficulties. And but if you want to get a hold of Medicare, there's their number, 24 hours, 7 days a week, 1-800-Medicare. Remember, no physical location. So you have to work with them on the phone. If you want to talk to me and get a script first, that's always advisable. And also Social Security is open as well if you want to. So I welcome to answer any questions. I can try to go to the app and see if I can find any, but not sure I know how to do that.
Don't worry, Martha. I can read them out to you.
Okay.
Okay. Yeah. So if anyone in the room has any questions, please put them in the chat box, and I will read it aloud for Martha to answer. First up, we got a question. First question I got is I signed up for Medicare Part A at 65 years old. I do not have Part B since I continue to work until the end of 2022. I have a private health insurance under my wife, and I continue to do so. Do I have to sign up for Part B now? Do I have to sign up to preserve the pre-existing conditions benefits, even if I continue to be covered by my wife's private health insurance?
Okay, that's a loaded question, but let me just restate it. Basically, the person signed up for Part A at age of 65. They did not sign up for Part B as in Bravo because they're covered under a spouse's plan, which is fine. Main thing there is make sure that the spouse's company has 20 or more employees, or it is a multi-employer plan. You do not need to concern yourself with pre-existing conditions because Part B does not look at that. So as long as you are covered under your spouse's plan as a dependent and her company has more than 20 people, you can delay enrollment into Part B until you will be losing that employer plan. So that sounds fine. Next question.
Okay. If you let go of the employer plan and have only Medicare, is it harder to find a provider who will see you?
That's a very good question. A lot of people wonder. That's one of the things I think scare people about going on to a full Medicare option is there's been a lot of conversation out there. Doctors don't take Medicare and they don't want to if you're a Medicare. But the reality is you should be working with, doctors. I mean, most of us have a doctor in our life from birth. So you should be working with primary care doctor, specialists, and you should see if your doctor takes Medicare. 71% of doctors do take Medicare. So if we had people who don't want to take Medicare, they would have empty offices. People don't live forever. So they certainly have to replace people who may not be with us anymore. So you should be able to find providers. But what I will tell you is this is true stories. What if it has happened? A person called me. She said, Martha, I can't find any doctor to take me. And I said, well, what are you telling the doctor's office? Oh, I just said I have Medicare. And I said, well, did you tell them that you have original Medicare and a supplement plan? Did you tell them you have a Medicare Advantage plan? I said, it's important for you to specify what you have because remember, with original Medicare, Part B, that's where the doctor comes. Medicare pays just 80%. So guess who the doctor has to track down for 20%? That would be the individual. So if the doctor knows you have a supplement plan, which will pay anything that the supplement plan doesn't cover according to the summary of benefits, the doctor doesn't have to track you down. If you have a Medicare Advantage plan, that 20%, it's may not be there. It may be a fixed amount that Advantage plan pays the doctor. So doctor knows they'll get paid. So very important to understand with Medicare, you have to let the provider know exactly what plan you have. Don't just call and say, oh, I have Medicare. Understand there's more going on. Next question.
Okay. I was over 65 and covered by my spouse's plan, and then her COBRA coverage, and then learned that COBRA is not considered credible coverage. So I incur an annual penalty for life for 2 year late enrollment period. Anyone to challenge this?
And thank you, sir, for bringing that up, because this is what I try to help folks avoid. And somebody told them that they could have this coverage. So I can't guarantee you that there's a way to challenge this, but what I do, I don't care. I'll just try. So I believe that you may have received incorrect information when you were covered under your spouse's plan. You turned 65 and then they said, oh, you can do COBRA. So if somebody incorrectly told you that you could have COBRA instead of picking up your Medicare Part A and B, I think that's worth challenging. It is very difficult to get them to overturn decisions, but I must say, I have seen decisions overturned. So if you can, show that you were provided incorrect information and you made a decision based on that incorrect information, and it was from a government entity or it was from an employer, what I would do, I would say, hey, we'll get that employer to explain that they gave you incorrect information. If you have the day and time of somebody you spoke to at Social Security or Medicare, we would include that information and we would go ahead and ask that be redetermined. And you're correct, if it's not redetermined, that is a penalty for life. And that is why I do what I do. I want people to avoid this. But I will say, sir, I had people from your group really fought me because they said, oh, the insurance company told me, oh, I called Social Security. And I said, did you tell them you're under 20? Or did you tell them, in this case, that the insurance you had was not credible? So people don't even know these terms. And that's why anybody listening, please feel free to call me. This exact question is why I do what I do. I really want to help folks avoid this. Next question.
Okay. I am 71 and on my employer's group over 20 plan because my wife is under 65 and is not employed. Would you recommend I also do plan B until my wife qualifies for Medicare?
Okay, great question. This is a gentleman says he's over 70 and he's still on his employer plan because his wife is under 65. So again, if your employer plan has 20 or more or multi-employer, then you're compliant. If that was not the case, or if you said, I'm ready to retire, then there's other options for your spouse. There's a plan called healthcare.gov under the Affordable Care Act plan. And I've had people who find lower costs for insurance under that than what they can get in COBRA or what they can get if they just reached out to one of our local insurance companies directly. You use that healthcare.gov program to cover family members under 65 when you've already reached that watermark. So please feel free to reach out to me and I could kind of share with you how you would go about doing that. If it turns out that you could get comparable coverage for your spouse that's under 65, then you want to do that. And you can do that at any time because she's currently covered. And then that would release you, if you wanted to be released from the employer plan, to go onto your full Medicare plan. I have to just real quick tell you that it was a situation like that where a person was employed. And I got to tell you, they were husband and wife. They were actually both in their 70s, but scared of Medicare. But their plan was $45,000 per year. $45,000 for this employer plan because they were a small business, they had high utilization, and the insurance company had to keep pushing that premium up. So I was like, hey, you can do Medicare and another type of plan that will cover, everything, and for about $300 a month. So you could save like tens of thousands. They were blown away. How come nobody told us? I said, because a Medicare supplement plan, I'll just go ahead and tell you, you probably don't hear a lot about it, pays an agent about $100. So they're not going to tell you about it because there's more money in other options that they can market it to you. So they're not bad. I love agents. I have an insurance agency, have agents myself. They're good. But if you don't really understand and you don't have somebody to take the time to explain it to you, many times people do not make the best choices. And in their 60s, 70s, and 80s, they're paying way more for their health insurance coverage than they need to. Sorry for the long-winded answer.
Next question. Can Martha, can you, what is your phone number and email?
Yes, I'm going to try to put it into the chat. My personal cell is 808-230-3379. I do like to give that out. And I'll be doing my radio show after this, so I won't be available until after 4 today. But, please feel free to reach out and try to schedule some time with me. And my email, I'm putting it in the chat, is gettoaloha@gmail.com. Gettoaloha@gmail.com. I do what we're doing here today under my community service banner. So I give out my personal cell. I do, and I answer it, and I give out my personal email. But if anybody wants to go look at my website, I'll put my website on here. Is get2insurance.com. I think that's my website. And then I have a staff as well, and I believe one of my staff members is on the line, Tasha Josui. I have other people that work with me. I'm not alone, but this community service is so important to me. Yes, I have kept track. I've helped people throughout the country save so far over $3 million, and I'm proud of it. Anybody tells me I don't value myself because I didn't charge anybody one penny to save that $3 million. I'll close with this. I was watching something on the news last night, and there's some trucks that go out and help people stranded on the road when there's an ice storm. It's all these Jeeps. And so they interviewed someone, and she said, people try to pay us for helping them, rescuing them when they get stuck in the ice. And she said, but come on, you see somebody stuck on the side of the road and you have the equipment to help them, and you're just going to pass them by, or you're going to go over to them and say, I could help you for $100. So I'm with that person that we have to get back to, in this country, taking care of one another. When there's a void, somebody's got to help us. And I'm the person that's going to help you with this Medicare. And you bring somebody else in for the sales, but I got to help you with this part, whether no matter what. I'm sorry, it's who I am. And thank you for letting me share and be with you today. Any other questions?
Well, we want to be respectful for everyone's time because it is past 1. If you have any further questions for Martha, please refer to the chat to get her email address or her phone number, and then you can ask her your question. Ask her your question, and then she'll get back to you as soon as she can. But yeah, let's. I want to thank Martha for sharing today, but let's give one last closing remarks from Gil. If you could try to get him on.
Can you hear me?
Yes.
Okay. For those of you who've been listening to Martha, she is a personal friend of mine. I got her on to speak with us, but she is a wonderful person, very, very contactable, and I strongly encourage if any of you have any questions, contact her. She's got a very good memory for names and numbers. She's helped my clients out, and always there to help out. So she's the real deal. Okay, so thank you very, very much, Martha Kloppen, and I hope that all of you have gotten some benefit from this presentation. And we'll see you, and have a nice day. We'll see you in the next coffee hour. Aloha.
Aloha.